people whom you might have said the same thing to, but I'm grateful for this community for allowing me to serve them and will continue to serve them. The piece that I want us to remember is that it's not just because of this that this community is great. It's because the people who have been here over the years and who find themselves moving to this community. I want to thank Gibby Harris and her team, along with our manager, Dina Dioria, and others, and our communication department for its supplying needed information that we have been receiving on a daily basis, almost on an hourly basis from the county's perspective. And I watched the city's meeting last evening, and they too were working on getting information out. And I did hear one of the people in the afternoon ask, where is the mayor? And I wondered about that question and why was that question asked. And I guess I have nothing to do with that. My job is to take care of those who preside in the county. But again, to the board members who sit here and who find themselves a part of it, and especially our staff who've spent endless hours and days in working through the process, coming up with answers to questions they have not yet been able to find those answers, but they will come. The faith community, and especially in the Black community, is a communication process. And it came to me in talking to some of the ministers on yesterday and today, is to put out some flyers, and I talked with our manager that we will find some way to communicate with our people who are part of the faith community, who believe in a supreme being and believe that all things happen for a reason and for good. But I pray that our state and I pray that our nation, because of this, that some stability will come to us as a community. Again, let me say thank you for affording me the opportunity to serve. I'm not sick. I don't need the gloves that I was asked, did I have gloves, and those kind of questions. So I will continue to serve you as long as the Lord says it's going to be there. But if you have questions about me, contact me and don't talk to each other. Thank you for the opportunity to serve. The last thing I want to say that this is Women's Month, and there are no stronger women than Black women. Sarah Stevenson, Carlenia Ivory, those two women have put in longevity as others have put into this community. I look at a Barbara Jordan out of Texas who spoke some years ago as it relates to the asking of Richard Nixon's resignation, a powerful lawyer who spoke with power. Many of you don't remember these women because you have not read the history of outstanding women of color, Black women. Fannie Lou Hamer, I think of her, who's my buddy, when I make reference to, I'm sick and tired of being sick and tired of issues that's going on in this community. I think about Mrs. Harris, Attorney Harris in California. Teach your children about these young people. And I say to us, people within your congregations, within your clubs, honor these women for what they have done and will continue to do. Because I wonder where we would be if it were not for women. The hand that rocks the cradle rules the world. Thank you, Mr. Chairman.
Good evening. My name is Susan Harden, and I represent District 5.
Good evening. I'm Dina Diorio, Mecklenburg County Manager.
Good evening, Tyrone Wade, County Attorney.
And let me just say for the public that we also have joining us for this meeting Susan Rodriguez McDowell, the District 6 representative, who would like to introduce herself and make a statement at this time.
Thank you, Mr. Chairman. Yes, my name is Susan Rodriguez McDowell, elected by the people of District 6. And first, let me just say that I wanted to express my sincere concern for members in our community who are dealing with symptoms, self-quarantines, facing loss of livelihood, and in fact, our basic way of life. And secondly, I wanted to let you know that I am not at the meeting tonight because I am self-quarantining due to my husband arriving home from a business trip to the UK with flu symptoms. Since I have been exposed to him, I wanted to make sure that I do not put others at risk. And I took him to a drive-through test today, and we're waiting on those results. I hate not being present for the meeting, but I believe that it was the right choice for me to make. I want to model the correct behavior and do whatever I can to limit the spread of this virus. Thank you very much.
You're welcome. So at this time, we'll have our invocation. Susan Harding.
To our beloved community, now, in the midst of the global spread of the coronavirus, this is the time for us to come together as one family so that we may experience protection, healing, and love. For those of us who believe in a higher power, may the collective strength of our prayers and kindness heal those who are sick with the virus. May they regain their strength and heal through quality medical care. Heal us from our fear, which prevents nations from working together and neighbors from helping one another. Heal us from our pride, which makes us claim invulnerability to a disease that knows no borders. Be with the families of those who are sick and those who are concerned. As they worry and grieve, defend them from illness and despair. May they know your peace. Be with the doctors, nurses, researchers, and all medical professionals who seek to heal and to help those affected and who put themselves at risk in the process. We place into your care all of the first responders, Mecklenburg County, City, and Charlotte-Mecklenburg employees who provide essential services that potentially expose them to danger. Keep them safe from harm. May they know our deep gratitude for all they are doing to serve our community. Heal and help those affected by the coronavirus. Be with the leaders of all nations, including the ones in Mecklenburg County. Give them the foresight to act with charity and concern for the well-being of people that they are meant to serve. Give them the wisdom to invest in long-term solutions. May they know your peace as they work to achieve it on this earth. Stay with us as we endure, persist, prevent, prepare, and act. In place of anxiety, give us your blessed assurance, wisdom, peace of mind, and steadfast determination to serve this community. Amen.
Please stand and join with me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I want to start tonight's meeting, first of all, with a thanks. And to say that we owe our county manager and our county staff a debt of gratitude for all the work that they have done as we go through this serious time in our community. I have spent a good bit of time with both, and I've watched as they've navigated through the press conferences and all of the things that they've done as it relates to the virus. And I tell you, I could not be more proud of my manager, and Gibby, and the rest of our staff. And to say that when there was some question about the leadership in the country, there's never been a question about the leadership of Mecklenburg County and the direction in which we're moving. And so I want to say publicly how much I appreciate and acknowledge the work that each and every one of them have done as it relates to this. And I look forward to their continuous guidance and direction as we go through this. I also want to say to the general public, I know because I've heard it from my colleagues, there is not a one person whom you have elected who has not exhibited great care and concern for what this community is experiencing. And while there are those who, just because of who they are, like to make sure that they're communicating and you have all the answers that you want, there are those who kind of sit back and let others take the lead. But in whatever way they are expressing themselves, know that each one of them are concerned. Each one cares, and they do things in their own way. But as a community, as an elected body, we're concerned about every citizen, from those who have done well in our community, as well as those who live on the margins. And we are going to do whatever is necessary to make sure that Mecklenburg County shines, irrespective of what's going on anywhere in this country. I think, as has been said by many of you, we have the greatest staff that exists anywhere in this country. And they've demonstrated that throughout the last couple of weeks. And so with that being said, I want to say to the community that you will notice an abbreviated agenda tonight. Some things have been removed, some things have been added. So if you're following the agenda that you have, it may not be the agenda that goes forward. So first thing we're going to do is I am going to turn it over to our county manager. There are a number of things she wants to do to update us and to make sure that we're still abreast of what's going on in this community, as well as a few other announcements that she needs to make.
Thank you, Mr. Chairman. In essence, we're just going to move my manager's report up to the front of the meeting because there's several things that we want to do, and I know that the public as well is interested in hearing kind of where we are. The first thing that I'd like to do is I'd like to have the discussion that we've been talking about over the last several days about helpsharmac.org, which is the Critical Needs Response Fund that has been launched by Michael Marsicano from Foundation for the Carolinas and Laura Clark, the CEO of the United Way of Central Carolinas, who are here tonight to make a special announcement. And tonight they are joined by Heath Campbell of Truist Bank, and I want to thank him for being here as well. And you can see they are modeling the 6-foot behaviors. We want to thank them for that. So at this time, I'm going to turn it over to Laura, who's going to get us started. And of course, we do have the item on your agenda, which is a matching appropriation to the an appropriation of the county to complement what is going to be announced here tonight. So with that, I will turn it over to Ms. Clark.
Good evening. Thank you, Chairman Dunlap, the Board of County Commissioners, and Manager DiOrio. The United Way of Central Carolinas is proud to join the Foundation for the Carolinas in partnership to launch the COVID-19 Response Fund, a necessity as our community continues to address the effects of the coronavirus pandemic. We stand here today to continue urging corporations, individuals, families, foundations, and others to help us match the speed of this developing crisis with the speed of our response. Already we see the need. As parents deal with school cancellations and the loss of income, workers and small businesses adapt to the new realities of a tightening economy, and those without insurance face additional challenges getting the care they need. Local nonprofits and human service agencies are who they turn to and rely on. Our COVID-19 Response Fund will support a range of nonprofits that are serving the people most impacted by the coronavirus pandemic. We need to make sure that we are there for the organizations that are there for the people who need it the most.
Chairman Dunlop, members of the Board of County Commissioners, and Chairman County Manager Dina DiOrio, thank you for this audience. And I want to thank Laura. She's a great partner. United Way and the Foundation for the Carolinas have a history of partnership, and we're proud to be part of this wide-ranging community effort. Whether it's launching pre-kindergarten education or addressing affordable housing or upward mobility or the economic downturn of 2008, this community has faced challenges in the past. The one constant in this previous crises has been we have collectively responded to those challenges. Now we face an unprecedented crisis. I'm touched by the support we've received so far from the launch of the COVID-19 Response Fund, and tonight it is my privilege to read a statement to you from Howard Levine, who could not join us tonight, and I will do so in his words. He asked me if I should shave his head because he's bald so that I could represent him better, and I said that was one step too far for a gift. This is Howard's response. Good afternoon. When Michael and Laura called to discuss the COVID-19 Response Fund, it was a no-brainer that my foundation would want to participate. I've long supported our neighbors in need through the impact nonprofits that work in the health and human services arena. I can only imagine the strain these nonprofits are facing because of the damaging effects of the coronavirus pandemic. That's why I'm pledging $1 million from the Howard R. Levine Foundation to this cause. Howard goes on to say, last night corporate leaders and city government stepped up. Today I'm here representing the Family Foundation community. It reminds me of a gathering we had together with the Commission at Foundation for the Carolinas just a few months ago. There I pledged $1 million to the Away Home Rental Subsidy Program, and I invited my friends in the county to join me in supporting it. You did so by creating Mech Home to serve individuals at risk of homelessness, and for this I thank you. I hope we can join each other again today because having private philanthropy, foundations, nonprofits, corporations, and city and county government working together is essential in the crisis. We need to make sure we are supporting the organizations who are helping the most vulnerable through the crisis. It's important for all of us to remember that the victims of this pandemic are not going to be just the ones who get sick. The economic slowdown is going to be just as hard felt and last just as long. I want to thank the leadership of Foundation for the Carolinas and United Way of Central Carolinas for overseeing this effort, and I want to urge everyone to contribute to COVID-19 Response Fund. In particular, I want to challenge my fellow philanthropists who are watching and those of you who have family foundations to contribute. Now is the time for us to come together for this community that we all love. Thank you. Howard, I know you're watching. We are most grateful for your generosity. Chairman Dunlap, members of the Board of Commissioners, and County Manager Dina Diorio, we have been here before, seeking your partnership with you in service to our county. It is our hope that our partnership is evergreen once again tonight. It is now my great pleasure to introduce a relatively new citizen of Mecklenburg County. He and his company have swiftly emerged as compassionate corporate citizens. Here with another exciting announcement is Heath Campbell, the Charlotte Metrolina Region President for Truist Financial Corporation.
All right, I have the distinct honor and privilege of being here representing our entire executive leadership team at Truist, whether it be Kelly King, our CEO, Bill Rogers, our President, COO, and all nearly over 2,000 associates and teammates that have joined us in this transformational period of time in our organization. And we couldn't be more proud to represent what the next act is, to not just live in the community, but be part of the community. We also want to thank, on behalf of Truist, all the elected officials in this room. I want to recognize Chairman Dunlap. Thank you for your leadership. All the board and county commissioners, and then County Manager Diorio, thank you for all of your leadership through these very difficult and unprecedented times. We'd also like to thank another strategic partnership, two strategic partnerships that we enjoy and have quickly learned to appreciate and respect, which is Michael Marsicano with the Foundation for the Carolinas and Laura Clark with United Way of Central Carolinas. We're thankful for their vision, for their partnership, and their commitment to the Charlotte region and Mecklenburg County. And like them, Truist committed to leading the way to providing virus relief in our communities. It is imperative we focus on those who are most in need and are already struggling to make ends meet. And the COVID-19 Response Fund, launched by the United Way and Foundation for the Carolinas, is the most effective way to do that. This money will go to nonprofit agencies who have long been at the front lines of helping the most vulnerable in our community and are already feeling the strain of trying to deliver services in the face of this unparalleled adversity. I hope every corporation, small business, and individual would join us in donating whatever amount you can to this effort. We stand in this united. Earlier today, Truist announced we will give $25 million for virus relief, and we also granted our employees paid sick leave and child care support through these unprecedented times. And tonight we join Michael Marsicano, United Way, Howard Levine, and a lot of other strategic partnerships to share in a new excited announcement that we would like to give $1 million to the COVID-19 Response Fund. We stand with our partners to address this unprecedented community challenge, and I'm confident we will be successful. Although we have a new name, Truist's roots in the community date back over 250 years when you combine both heritage organizations. We indeed are all in this together. We've weathered the storm over 250 years ago through the Great Depression. We stand united and fight through this challenge that we face today. We're proud to be part of this community, part of Mecklenburg County. Thank you for your time.
Heath, we are so grateful for the generosity of your company and the leadership that you're showing in our community. Members of the Distinguished Board of County Commissioners, Michael, Heath, Howard Levine, and Spirit, and I come before you seeking your partnership tonight, and at this time ask for your support in this effort.
Thank you, Laura. Thank you, Michael. Thank you, Heath, for being here. And as you know, we have an agenda item on our board tonight, on our agenda tonight, an item to appropriate $1 million to this fund to show our support for this effort. As we have been talking a little bit amongst the board members, I have raised, and I will be honest, raised some concerns about ensuring that we do make sure that some of these dollars do go to support the homeless. I know I've been on calls over the last 3 days about the support and the needs of the homeless population in this community as it relates to this virus. We are engaging in a number of activities to make sure that the homeless population has places to go, not only if they're quarantined or have to go into isolation, but working with shelters to reduce the number of people who are in the shelters to make sure that we have appropriate social distancing, because as you know, those quarters are incredibly tight. We are happy to do that. The concern that I have is as we move forward, we may see the number of homeless individuals and families rise in this community as a result of this virus. And I know that this fund is absolutely dedicated to helping as many people as possible, but I do not want the needs of the homeless population in this community to go unnoticed or unsatisfied. And so with that, I just did put that out there as something for you to consider. So with that, Mr. Chairman, I'll turn it back over to you.
Well, thank you, Dina. Let me first say to our corporate citizens how much we appreciate your contribution. You guys have been there with us through a number of challenging times, and you remain steadfast, and you continue to support us, and we couldn't be more grateful. To Howard Levine, who's not here, we certainly appreciate your generosity, your love for this community, and as Vilma would say, he's not a Johnny-come-lately. He has always stepped up to the plate, and we are forever grateful. To Laura, who works so tirelessly with the United Way, we appreciate your efforts and what you do for those who are less fortunate. To Michael, who always steps in front and kind of corrals everybody and not necessarily put the pressure, but a gentle ask that they all respond to. We are so grateful. And to Heath, of course, we hope to get to know you better. I've known Kelly King for some time, and I've had the pleasure of meeting Bill Rogers. And one thing I can say about both of these gentlemen is that if you talk to them for any period of time, you know that they have a giving spirit. I've been in their presence a number of times, and you know, some people will do what's appropriate for the occasion. But Kelly King and Bill have been consistent. Every time I've been in their presence, they are really concerned about the community that they serve and the community that they live in, and they step up to the plate whenever they're asked. So we could not be more grateful for the work of our philanthropists, for the work of our corporate citizens, and I know there'll be more. These guys have put out the call. This is the beginning of the process. And so for those citizens of Mecklenburg County, be grateful that you live in a caring community
Mr. Chairman?
with caring corporate citizens. And so on behalf of our board and the citizens of Mecklenburg County, we thank you so much for your contributions. Yes.
Thank you, Mr. Chairman. I would actually like to offer an alternative action.
Let's hear it.
So I'd like to amend the 2019-2020 annual budget ordinance to appropriate $1.3 million from the general fund balance to the helpsharmec.org fund for COVID-19 support designated for homelessness and relief for working families facing challenges. And let me tell you why I'd like to make that amendment.
Let's get a second. Okay, it's been moved and properly second. Now discussion.
So yesterday, we saw the city of Charlotte step forward with $1 million donation, and I certainly want to applaud the city for doing that. I'd like to see this board take leadership by providing a greater contribution and recognizing that we have to support our towns. Basically, the city has a population of 872,000. Mecklenburg County has a population of almost 1.1 million. And so I'd like to see that per capita contribution increase for Mecklenburg County to recognize the important support that we need to provide our towns. And so I think that it's critical that we as representatives of the county in total make sure that the needs of our citizens in our towns are brought forward as well as the needs of our city. So I'd like to see our contribution reflect that.
All right, Commissioner Rodriguez McDowell, I know you wanted to share your concern about this as well.
Yes, I would like to second that motion because I really appreciate the sentiment that Commissioner Hardin has shared, that especially as a commissioner for District 6, which has 3 towns, and also ETJ, to make this a per capita amount of $1.3 million. I support that notion. Thank you.
All right, Commissioner Durrell.
Thank you, Mr. Chairman. I want to start off by just saying thank you to our corporate partners. On behalf of the citizens of Mecklenburg County, I think this is the way we should be working together. And it's happened in the past, and I'm glad to be a part of it now. And with respect to Commissioner Hardin's motion, I think it's spot on. I mean, we have to think about the towns, and basing it on per capita is the appropriate and right approach. I do want clarification, Mr. Chairman, regarding, I know the motion included homeless and families, but I think if I heard the manager correctly, there was some thought around appropriating the full amount to just the homeless, or when we were at the 1 million mark.
No, I just want to make sure that there's recognition by our friends here that there's recognition of what the priorities are. And so it wouldn't have to necessarily be earmarked specifically for that, but it would definitely have to be a priority as our dollars are distributed throughout the community.
So thank you. I think I certainly would support that. I mean, our homeless population is our most vulnerable, but I also want to make sure that we keep in mind and at the forefront of our minds our working poor, our seniors, and provide a stopgap so people don't fall into homelessness. And so there's, I just wanted to make sure that we had that clarification. So thank you, Madam Manager.
Commissioner Leek.
Thank you, Mr. Chairman. Let me first say, you all scare me to death standing behind me. I don't know what you got in your pocket. I hope it's money, though. Let me say thank you. I've been in this community since 1964. Marciani, is that the right pronunciation of your name?
That's closer than most can.
You look like you might be 25, but he's older than I am, children. He was here when I got here, so he has to be older than I am. So y'all worry about him being of right place and where he ought to be. But as long as I've known this young man, when I met him, I was on the school board. His heart was always out there for Mecklenburg County. And as we travel across this country to emulate what was done elsewhere, he talked about what we needed to do, how we needed to do it. And I can never say thank you enough for making Charlotte Mecklenburg what it is today. You are due the credit for your geniusness and your concern about this community and what it means to the rest of this country. So we cannot say enough, and I'm glad I had the opportunity to live this long, to say this to you. We were either in some place where they play baseball, and you looked up and you saw it, and the theater part, and all of this, the dream that you had. And I'm not going to say wake up. I want you to keep dreaming, as did Martin Luther King. I beg you to help us to deliver those who are born in poverty, whom those have said will never come out of poverty. We need your help. My district needs your help. My community needs your help. So all I'm saying to you now, my brother, you may be of one complexion and I as another, but I perceived you to be a true friend to this community, regardless of race, creed, or color. I could not sit here and not say this to you because I might not get this chance again. But don't forget what I've said to you. For a charge you have, and your job is to serve this present age, my calling to fulfill and to do the Master's will. God bless you, and thank you so much.
Commissioner Fuller.
All right, thank you. And let me just add my thanks to the work that all of you are doing. Heath, welcome. Laura, as always, and Michael, as always, stepping up to the plate. You know, we take this for granted sometimes because we are such a generous community. We take for granted sometimes the depth of our generosity. And so I think it's especially important in times like these to recognize our generosity, to not take it for granted, to encourage others to be just as generous, whether you've joined our community more recently or been here for a while. We have to always remind ourselves of our commitment to each other, and not just in words, but in deed, and that we put our money where our mouths are. And we have done that in this community. And this is another example of it. You know, it's easy, I think, in times of crisis to come together or say that we're together. But when we actually put our resources in the pot, because we all understand that we are in this together, no matter where we come from, what part of this community that we are. This virus doesn't care about race. This virus doesn't care about your economic situation or where you live. It does not care. And so, if we're going to be a community that survives, we have to work together. And I think it's important to call out Mecklenburg County as an example of how we do this. We're a relatively new community, relatively of this size. But I think what we have been doing for decades is showing the model of how people can live together who are from all different places, all different strata of society, different ethnicities, that we can actually get together and do things together in crisis and when we're not in crisis. And so I'm very thankful that this fund is coming together. I haven't heard of this in other communities, but maybe I just haven't been listening. But I like to think, and I will prefer to think, that we are in the lead once again in doing something like this. I certainly thank Howard Levine and really the whole Levine family that has been generous contributors to this community. And so it is no surprise that Howard's foundation has stepped forward with this kind of funding. And I'm thankful for Truist and its corporate citizenship. Again, an example of how public and private entities can work together. That is another thing that we excel at in this county. And it's not just fluff. I hear county commissioners and many other communities across this country who are astounded that government and private entities even talk to each other, much less work with each other. So again, we can't take this for granted. We have to continue to nurture this and curate this kind of a partnership with each other. And so I'm just so grateful that we have done this. I think now what we want to do is carry through on this promise and tell people how they're going to be helped by this specifically. Where can I go? If my family's in need, where do I go? What can I expect? What kind of help can I expect for my family? And so I'm hopeful that our county manager, and I know that our county manager will be in the vanguard of that in helping us translate this to individual people's lives. Who do I call? Where do I go? And I'm grateful that the nonprofit partners that we have that are going to be receiving funds from this fund, that they're also part of this coordinated effort. I wonder whether even our contribution is enough. I think maybe we might need to consider more. But for now, I'm certainly approving of and will support Commissioner Hardin's motion. But I'd also like us to be prepared that we may need more in this community, and that the county should be in the lead on that. I want to take this opportunity also, as the chairman did, to express my thanks to our county manager, our public health director, and all of our county executive team and staff who have done tremendous work in keeping our community informed about what's going on in Mecklenburg County. I'm thankful to my colleagues also who see the importance of letting our professional leadership do the messaging. A lot of people like to get in and have their say and, show how involved they are. And while that's important, I think it's also important that we have unified messaging, that people can rely on what they hear from this county. And our county manager and our public health director have been doing a tremendous job in that respect. I would say, again, that I find their leadership to be more reassuring than the leadership, or lack thereof, from our federal government. I'm just going to say that. I think we have been consistent and we have been steady. We have consulted with the experts and have calibrated our messaging based on what our experts are telling us, not because of political concerns, not because of anything else other than the health of our communities. So I want us to continue to do that. And in our meeting tonight, I hope will provide additional assurance to our public that that's where we're going. The chairman could be making press conferences every other day, but he's not doing that. He's letting our professional leadership inform the public on what's needed. That's the way it should be, I believe. So again, thank you. Thank you to United Way and the Foundation for the Carolinas, for Truist and other corporate partners who I know will join from your lead. Thank you for your contribution. I'm so proud to live in this county. I'm so proud to represent the people who live in this county. It gives me great joy. Thank you very much.
Commissioner Powell.
So thank you for stepping up and doing something positive, because I think positive matters and working together matters. And so it's nice to start our meeting off like this. I was very lucky to grow up in a family with servant leadership. My grandfather was a Knight of Columbus. And so throughout our lives, he would talk about helping others. And when things got really tough, he said, help more people. I think that he would like to be friends with you. Thank you. It is a very nice way to start this meeting. I want to make sure that as we are working together to solve problems, that we make our priorities clear for the community. I don't know if we need to designate the portion that we're going to match, or the 1.3 million, whatever we match, if we need to designate that for homeless and working families. But these are important priorities to this board, and so I think we do need to have discussion on that. Do we want to designate it? Or do we need to? Or can we just trust that you understand these are our priorities? And I also wanted to support what Commissioner Fuller was saying. I had a flood in my district, which was a crisis for many families. The number one thing that they asked for was clear, consistent communication. And the second thing was, they said, don't send anyone without compassion. And so I am very thankful to all of our leadership in this county for their clear, consistent messaging. I think it's one of the most important things we can do right now. So while we're getting bombarded from media, I want media to understand that it is important for us to be clear and consistent in our messaging. We are doing the best that we can to problem solve and to make sure everyone is as safe as possible. So thank you for starting off this meeting with such a positive note, and hopefully you'll do some more positive work, and we will definitely solve this together. Thank you.
Okay, well, I don't want to belabor this, and I will tell you, given what our county manager said, I had some concerns as well because of our priorities and the concern for the most vulnerable population in our community. But I think Elaine raised the question, and let me just say that given who's standing before us, I am going to trust that you have heard the concerns of this board as it relates to those who are on the fringes, and to ensure that they are taken care of. Those are the ones who are least able to take care of themselves. And so, given your investment as well, I'm sure that you can appreciate that. So, without further ado, all those in favor, who? Okay, Pat, well, you have to raise your hand. I can't just know that you're there, okay?
I know it's hard to see. It's hard to see. I just wanted to chime in and also thank you for your leadership and for coming together, and also for the Levine Foundation. They, year after year, decade after decade, they're always there. And this is how we're such a great community. And I do hope that you listen to our concerns about our homeless neighbors. And there are and I believe we're going to have future homeless neighbors. From the phone calls I've been getting right now, the last few days, I'm sure my colleagues have as well, I don't know what I'm going to do, is what they're saying. And I had a young student from Central Piedmont that already lost one tent, and I got it replaced, and then he lost it again. Someone came in and took all of his stuff. And but we're going to have more of that. And so this is who we are too, and we are their voice. We are their voice. And we just ask you to remember that when we're doing this, and remember that we stand with them, and they are a valuable part of our community. And so many of them are so close to getting the education they need, to getting the certification they need to, and many of them are already working. Always remember that. Our homeless population, a great percentage of them are working. So thank you very much for all that you're doing. Michael, you're always there and have been for years. And I've seen you in so many places, and you're always bringing good news to us. But thank you for all the work that you do and all the relationships that you have. And it's so good to have our, Keith, is it?
Keith.
Yeah, just for the public to know, Truist is the blend of VB&T and SunTrust, correct? And you took two great banks and made it even greater. So thank you very much.
All right, all those in favor of the motion, let it be known by saying aye.
Aye.
Any opposers? Okay, I'm sorry, Susan Rodriguez McDowell, how'd you vote?
Aye.
Okay.
Thank you.
All right. Any opposers? The ayes have it, so carries the motion.
I am going to break from protocol, and I am going to say to my friends, I have worked with elected bodies for a very long time. I have never heard the elegance and the eloquence of what was been said around this table, and I have never received such a high calling. We've never received such statement of trust. I want to thank you from the bottom of my heart. We will not let you down. I also want to thank Heath and Truist Financial and Howard. You've only been part of this community for a short time, but the Truist impact has already been quite extraordinary. And all of us are thrilled that you have come to call Mecklenburg County home. As we have recently seen with your work on universal pre-K, the creation of Mech Home to combat homelessness and countless other initiatives, time and time again, the county has led the way in partnership with the foundation. We're grateful to follow you as we all work together to tackle this challenge. The moment truly calls for us all to do our part. Public health is an area that affects everyone, and the safety and well-being of our loved ones is an issue that unites us all.
I want to extend my gratitude as well. This has been, as I'm sure it is for all of you, an emotional few days. And as someone who was born in Mecklenburg County and has the privilege every day of working on behalf of nonprofits that are helping those that you're most concerned about, I know that I can say thank you on their behalf as well, that we are going to do this together. That's what Charlotte and Mecklenburg County are all about, and this isn't going to be any different from any other time. With that, though, I am pleased to report that counting the decisions made today, in just 2 days, we've raised more than $5 million now for the COVID-19 response fund. However, I'm also confident, as you are as well, that tonight more is needed, and I'm sure that more will be given because of the generosity of our community. It's vital that we continue to support these organizations that are supporting the most vulnerable among our community, and you have our commitment, just like Michael's, that your priorities are our priorities, and they are the priorities of the organizations that will be funded. So please give today, for all of you that are watching as well, at helpcharmec.org, helpcharmec.org. Thank you for allowing us to be here. Thank you for your generosity, and thank you for all the work that you're doing to keep our community safe and thriving.
And thank you as well.
Thank you for being here. We really appreciate you taking the time to be with us this evening. Mr. Chairman, the next item under my manager's report is a COVID-19 update. Gibby Harris will provide a full update on where we are and our situation today. She will be here to respond to any questions that you have, and at that point, she will be going to another room. I think sure the media is going to have questions for her as well, but she will stay here and answer as many questions as you have. And so with that, I will ask Gibby to come to the podium.
So before Gibby starts, let me just share that last time we did not have an opportunity for the board members to ask questions. and I promise that you will have that opportunity. But let's be respectful of the time, because she also has to do another interview with the media when she leaves here.
All right.
All right? Thank you, Gibby.
Thank you. Chairman Dunlap, Commissioners, Manager Diorio, and the few other people that are in the room tonight. I appreciate the opportunity to give you an update and to answer any questions that you might have. So to date, we have 11 cases in Mecklenburg County. Those have almost tripled since the weekend. So we know that we are testing more in this community, and we expect to see more over the days to come. And of course, my notes just died. There we go. We are continuing to monitor those individuals. They are in isolation at home at this point in time. We've been grateful that none of the individuals that have tested positive to date have been seriously ill, but we know that that's something that may be coming in the future, and we're working with our hospital systems to make sure they have what they need and that their staff are protected as well. Testing has been a concern and an issue that's been voiced across the country. We know that we have had limited testing available in this community. That is improving significantly. Over the past 24 hours, we tested over 100 individuals in this community, and that number will continue to grow. Our hospital systems are in pretty good shape right now for testing, but we are continuing to make sure that we are testing the people we need to be testing. We don't have sufficient testing services available to test anyone who wants a test at this point. So we are continuing to look at the symptoms the individuals have, the exposure that they may have had, and test those individuals who are most at risk and are having the most serious symptoms. That includes those folks who are hospitalized with unexplained respiratory symptoms, also people with flu-like symptoms, fever, cough, shortness of breath, people who we know have been in contact with somebody that has COVID-19, people who have traveled, especially overseas, and especially in certain countries, but also in some spots in the United States. So our immunocompromised individuals and those with chronic diseases, we're paying close attention to as well. I also want to remind the public, while I have this opportunity, to call ahead. We do not want individuals going to our emergency rooms, to our urgent cares, or calling 911 without providing information about their circumstances ahead of time. We have got to protect our first responders and our healthcare providers if we're going to have the services in place to take care of the need as we move forward. And I also want to urge people not to call 911 unless it is an emergency. So we continue to remind people of that. Our Emergency Operations Center has been open for a little over a week now. We are in full swing at this point. They are working with lots of different partners on lots of different issues to make sure that we're best using our resources. We're working with the state to make sure that our first responders and our hospital staff have the supplies they need to be able to protect themselves. We're working on issues of child care for our first responders, our medical providers, and our essential staff. We're working with the homeless providers in this community. So there's a lot happening in that space right now, and we will continue to look at ways to improve our coordinated effort in this community. We have many agencies and organizations working within the EOC, including churches. We have volunteer organizations that are organizing and making sure that we are doing a good job of providing the services we need to provide. I myself am very grateful for the leadership at all levels. The county manager has pretty much given 100% of her time over. She's seen a whole lot more of me than she's probably ever wanted to see. But she has dug into this issue, and as well as the entire executive team, all of those that are working in the EOC, my staff in the health department, I know the hospitals and our first responders are all giving it everything they have right now to make sure that our community is safe and taken care of, and I'm grateful for that. I'd be remiss if I don't reinforce the prevention message. Everybody in this community has a role in helping us contain this and mitigate this situation. So again, you'll hear this over and over and over again. The personal things that you can do, Wash your hands. Know that you know how to do it. People assume they know how to wash their hands. There is a good way to wash your hands and a way that is just no more than a lick and a promise. So there are videos online. There are any number of songs that you can sing that are being posted out there while you're washing your hands to make sure you get your 20 seconds in. Cover your mouth and your nose with your sleeve or with a tissue, not with your hand. Make sure that you're avoiding touching your eyes, nose, face when your hands are not clean. Avoid close contact with people who are sick. And I've got to remind people, if you have symptoms of respiratory infection, if you have a fever, please do not go to work. Do not send your children out into the community. Obviously, we're not sending them to school right now, into a daycare setting. Make sure they stay home when they're ill. We still are in the middle of flu season, folks. We are still seeing widespread flu. If you have not had a flu shot, it is not too late. And that will help us in any number of other ways. So consider getting a flu shot. Another area of making sure that you're contributing is keeping your environment clean. So wiping down surfaces that are touched often, whether that's at work, at home, at church, wherever you might be. And the third is the community response, and that really speaks to the issue of social distancing. We're talking about that a lot these days, as well as avoiding mass gatherings, and I'll talk about that more in a minute. And then specifically taking care of those who are most at risk. We've talked about that as well. People over 65, people who have multiple chronic conditions, and people with immune-compromised systems. These are individuals that we are trying to protect because these are the individuals who are most at risk for adverse reactions to this infection. When you think about protecting these individuals, you think about them staying at home and staying away from other people. But we interact with our elderly all the time, whether it's our grandchildren, whether it's your church coming in to visit, whatever it happens to be. So just think seriously about how you interact with them and what you bring into their environment. I want to remind folks that 80% of the cases that we have seen so far have mild symptoms. So yes, this is a serious situation because so many people are affected by it, but again, 80% have mild symptoms. The other piece of data that I will put out there is that 90% of the cases survive this, 98%. That's pretty significant. Again, that is not to minimize how serious this is, but to help us understand and not to panic and to do the things that we need to do to take care of ourselves. I want to speak about the mass gathering order that was issued that speaks to limiting gatherings of individuals less than 50 in our community. We are sticking to that less than 50 number, but as you know, the president recommended less than 10. What I'd like to say is we want individuals to make decisions based on their situation, and we are asking people to limit their interaction with others. Unfortunately, or fortunately, in most cases, human beings are we're people that like to be with people, right? And so this is difficult for us. But as much as you can, limit your interaction with others, especially those who are most vulnerable or those who may be ill. As you know, the governor today issued an executive order around restaurants and bars, except for takeout and delivery. That will go into effect, and we are supportive of that executive order. We are adding gyms, health clubs, and theaters to the list of restrictions in Mecklenburg County. That is the addition that is being made to our order at this point in time around mass gatherings. I know that's difficult, but if you think about the less than 10, people don't need to be in those environments.
Can you repeat those, Gibby, please?
Yes. We're looking at gyms, health clubs, and theaters. We are not making any decisions about child care centers at this point in time. We've talked about that. They are still open. The state's recommendation at this point is for them to stay open, but the state also has a group that is working on recommendations for child care. At this point in time, we understand that those recommendations are likely to come in the next day or two. So rather than moving ahead with a recommendation here in Mecklenburg County, we will wait to see if the state comes up with something by the end of the week. We're making and will continue to make these decisions based on federal guidance and on the epidemiology of what's happening in our community. Those will change and will continue to change. They're almost changing on a daily basis. So we may make some recommendations today, and they may change tomorrow, and we hope that people can be patient with that. We will be as consistent as we can be. But the main focus here is to protect our community and to continue to try to reduce the amount of people who are exposed to this virus. We do understand the impact these restrictions are having on individuals in our community, especially our most vulnerable. I'm really grateful for the efforts that you've just talked about and the dollars that the county is contributing, as well as others in our community, to help mitigate some of those impacts. Please know that we do not institute this order lightly. There's a quote that I want to share with you. In the end, it will be impossible to know if we overreacted or did too much, but it will be quite apparent if we underreach or did too little. So that's the end of my report, and I'll be happy to take questions.
Okay, so we're going to go around. Don't feel obligated to ask questions. Given the topic and the time limit, I want to respect Commissioner Leake's concern. We're going to set the ground rules up front. You can ask as many questions as you need to within 7 minutes. That's going to add an additional hour if everybody takes that 7 minutes. But I will keep the timer, so you won't get more than 7 minutes. All right, we'll start with Commissioner Harden.
Thank you. Thank you, Gibby. I appreciate your presentation. I can tell you that my constituents want us to implement the highest and most vigilant protocols to reduce community spread and prevent disease being passed on. I can tell you we want to see the most and strongest protocols that we can put in place. So I have some questions that lead to that. I would like to see Mecklenburg County be the highest tested county. What actions can we take to achieve this outcome?
We're working with the hospital systems right now. They are instituting some testing in the community. We have some other community partners, physicians' offices that are also instituting some community testing. And we have others who are contacting us who want to do that. So we are looking at all the different ways that we can support that effort and make sure that that's available in locations throughout the community. I think that's one of the challenges that we have, is making sure that everybody doesn't have to go to one location, because that just impacts the social distancing issue that we have. And again, right now, to date, we have not had a problem testing those people that needed to be tested. Okay, I will say that. That does not mean we have been able to test everybody who wants to be tested. So we, again, are working through that, and we are seeing an increase in the availability of testing in our community. That's been slow, but I think we're in a pretty good place right now, and I think you'll see a lot more testing in the next week as we move forward.
Do we have enough protective equipment for our community, including local health providers and hospitals?
We're working through emergency management, they're working with the state, and the state is working with the federal government, especially with the strategic national stockpile, to make sure that we have those resources. I know that I have formally sent several requests for a number of individuals and a number of groups and partners in the community up to the EOC, and they're working very quickly to get those resources here if we don't already have them. So I will not say that we have 100% of what we need right now. And as we move forward, I will say that there will be challenges with that, because we are going through protective equipment fairly quickly.
Should volunteers providing food relief to communities wear protective equipment, or what type of protective equipment should they wear?
At this point, they don't need protective equipment. I'm not sure it'd be helpful, but my recommendation would be that for those wanting to provide feeding, that it's a drop and go. We don't want them bringing people into a location where people are brought together to eat. That is not the recommendation at this point. we will put out information about how people, if they want to be connected with the EOC and the coordination that's going on around that they can send information in and they'll get connected to that system. We're also providing some guidance through our environmental health program to make sure that people that are providing food are doing it in a healthy way. So the last thing we need is a foodborne outbreak.
Should volunteers undergo, who are helping or trying to do serve the community, providing relief efforts, should they voluntarily take their temperatures?
It depends on what kind of volunteering they're doing and what kind of interaction they're having with others. We are not necessarily recommending that everybody takes their temperature all the time, but we want people to be self-aware. How are you feeling? Do you have a cough? Are you short of breath? Do you feel like you have a temperature? You need to be self-aware and not expose yourselves to folks if any of those symptoms occur.
So universities and colleges are full of scientists and people who are trained for labs. How can we utilize this knowledge and expertise to help?
That's a good question. I think one of the things that we are looking at is how we can work with those individuals to help us in terms of mapping what's happening within our community. We've got epidemiologists that are working on that, but I do believe there are others in the community that can help us with that. In terms of, I do know that there are conversations happening across universities throughout the country about the different types of approaches that could be taken to help mitigate this, whether that's through medication, whether that's through testing, whether that's through the whole development of vaccine. So I think there's a number of different ways those individuals can be engaged, whether that's locally or nationally.
So I understand that the Emergency Management Operations Center is coordinating volunteer efforts. How can groups who are interested in being a part of the volunteer effort work through that group? Who would they reach out to? How does that happen? Because what I see happening, Gibby, is that a lot of community groups are just going.
They are going.
And they're not coordinating through the Emergency Management Operations Center.
So there is and before I leave, I will have that pulled up to tell you, there is an email address where they can email and someone will be back in touch with them. They need to let them know what it is they have available, what they would like to do, and what resources they can bring to bear. And then the folks that are coordinating that will be back in touch with them to make sure they're connected to the bigger system. So before I step down, I'll have pulled that up.
And then I have one last question, and it's my understanding today that the governor is reducing barriers or restrictions to apply for unemployment benefits.
That's what I read. I don't know a lot specifically about that, but that was part of his executive order, I believe.
And my question, maybe this is good to Danny or to the county manager, can we create an infographic to push out information over our social media about how our constituents can apply for those unemployment benefits?
Yes, we can. We have to do some research about exactly how that works at the state level, but absolutely we can do that.
Thank you.
Sure.
Okay, Chairman, I'm done. Thank you.
Yeah, you had 1 second left.
Wow, that's amazing.
All right, Commissioner Leak.
Thank you, Mr. Chairman. Let me again say to you, Gibby, thanks for what you do and how you do it, and you came at the right time for us. We might not have realized it then, but now the good thing is that you're here. How many people on your staff working directly under you with this project?
Well, they're layers. So I am serving as the incident commander for the county.
Right.
And I have within my department, so I am basically providing oversight, working with emergency management with all those different entities that are working on this throughout the county. But then there's my staff.
The immediate staff who's helping you to get done what's necessary.
So I have my leadership team, executive team through the health department is serving. I have an incident commander at the health department. They are working daily. We have pulled our school nurses to work in a number of different capacities
You're not hearing my question.
Okay, I'm sorry.
Your immediate staff, not people, I know you have a clerk and you have whatever else. What and how many staff members do you have?
Total within the health department, is that what you're asking?
Yes.
I have about, let's see, I have a little over 850 positions. I think we've got 100 vacancies
Now,
right now.
850 people are not working on this project.
No,
That's what I'm asking. How many is working with you?
working with on this project. I'd say we probably got at least 250 to 300 working specifically on COVID-19 right now.
And your communication with these individuals, is this at one time or in segments so that the information is not screwed, that you communicating the same thing with the
So what we have
staff?
What we have done, again, working within the incident command structure that we do when we have events like this, I have, excuse me, did I hear?
No, I just coughed, excuse me.
Sorry.
Sorry.
We have an incident command structure, so I have an individual who is the incident commander, and she is responsible for making sure that and there is a whole system of how that communication cascades down.
Right.
And we have a few individuals within the department that are helping us develop that communication and make sure that it gets down the way that it needs to staff.
All right. I'm just wondering about the number of staff members that's immediately close to you in helping you to develop what needs to happen. That's my concern, if you have enough people that you need to help make happen what ought to happen in Mecklenburg County.
Well, I will tell you, one of the positive sides of the schools being closed is that I can use all the school nurses to help us with this. So
All right.
that has increased our capacity significantly.
All right. My next, I'm sorry.
Yes.
Go ahead.
We also have added some LPN staff that we've hired on a temporary part-time basis.
Thank you.
We've also hired some administrative staff. We're in the process of trying to find some extra communicable disease nurses to assist with that, and we've also had some retirees that have come back to assist Gibby as well. So we are pounding the pavement, looking for every resource that we can in this community to help assist us with this effort.
Thank you. This is what I needed to know, is that we do have the foot soldiers out there.
Yes, ma'am.
But then you have the people with whom Dina just spoke of that can make it happen, implement what's necessary to take place.
Well, I will tell you that the county leadership has been extremely helpful.
She answered it for me.
Okay.
Thank you. Now, my next question is dealing with communication with the government, the federal government, because you get different information all day long from the federal government and the state government. We don't want that to interfere with each other. So how are we handling that?
So if I had to count, there's probably as many as 10 conference calls every week with different pieces of information that comes from the CDC. It also comes from the state, as well as some of the regional calls that we have to make sure that we're coordinating. So we have individuals that are on these calls and then transcribe that and give us information, and we're just making sure that we're coordinating
So
it
we
all.
are in tune with Washington, D.C.?
Absolutely. Yes,
Are
ma'am.
we in tune with our representatives in Washington, Dr. Alma Adams and Tillis? Are we in communication with those two people?
I've particularly been directly in contact with Alma Adams' office. They've called me several times. Have
Very
not
good.
heard from Tillis.
Thank you. The next question I have, and thank you so much, about the feeding of our children from the buses. How is that being done? Are they getting food and putting it on there and going to given neighborhoods or what? Or we may not know.
What we heard from the superintendent yesterday, there are 70 feeding sites.
All right.
Across the county, and they're on their website.
All right, so people have to get there too, you know. So that's a concern I have of transportation of those individuals, families who may need to get there. My next question, and probably my last question, is what then can we do as board members to not interfere with what you're trying to do?
I haven't.
I'm not going out to Kentucky Fried Chicken and buy a bucket of chicken, because that won't go anyplace. I'm not going and buy four blankets. That's not gonna help, and call the news media and say, look, see what I've done. What can we do to stay out of your way so that we can reach our people?
Can I answer that, if you
Yes.
don't mind?
Yes, you can.
What I would suggest is that if you have questions or you're hearing things in the community, just email me and let me know. I've gotten questions from a number of board members, and I've tried to find information and answers to those questions. So the easiest thing that you could do is let us know, because if there's something going out there, you can hear about it before we hear about it.
Right.
So that's the most helpful thing you can do, but it also allows us to get those answers out, and you not getting in the way.
That means the community, and a group of ministers, I'm sure Mark Jarrell has talked to some, I have talked to some, and I don't know who else, I mean, pertaining to the black community, not just taking pictures, that's not what we're about. How can they disseminate the information to their congregations? And one of the things that they came up with was producing flyers, and you did mention the fact posters. That's good, but I was thinking about signs that we can put on the street that has information front and back, like their political signs. They give you telephone numbers and give you places to go.
Commissioner Leak, I know you hear this timer.
So Commissioner Leak,
She
let us-
talked longer than I did.
Well, let me investigate that.
You
I
all
know
had the
that's a
same
little
7
bit
minutes.
more
It didn't change.
complicated.
You got a black 7 minutes and a white 7 minutes.
Thank you, Commissioner Fuller.
Let me say thank you to both of you, and I'll finish talking to you off the pocket.
Yeah, how do you follow that? Anyway. So I've got questions, I've got a lot of questions, but
And I'm gonna time you.
the sense I have is nationally and maybe locally too, that there is a deficiency in the resources that are available to do the testing, potentially to do treatment. I've heard, just as you've heard, the national conversation about resources for people who are affected by, whether physically affected by it, but economically affected by the virus. So Commissioner Hardin touched on a couple of those things that I want to follow up on. One is testing, and I understand that that's an issue. Are there any resources that we can develop here in Mecklenburg County that can help this testing issue? In other words, it seems like we're waiting for the federal government to get us those resources, but is there anything we can do locally to make more testing available to the community?
I was thinking about that today. Right now, I think part of the problem is that people don't know what's available. We haven't really put together a package and put it out there that said, this is the process, this is where you can go get tested if you need to. But again, right now, we're asking people to call before they go. So we want to make sure that people know where to call. So I think we can work with public information to get more information out. That's the first step. The second is continuing to work with our partners to get better organized about this. I think we've got different organizations kind of doing their own thing, so we're not as organized, which means we won't leverage our resources as well as we could.
All right, so let me stop you on that point, because that's an important point. So you mentioned that you are the incident manager for this crisis at the Emergency Operations Center. So does that mean that when it comes to our emergency response, that you are the person who is making the decisions about what to communicate, how we coordinate, those things?
That's the role that I've been given.
Okay. So what can we do? Is there anything that we can do to help in this coordination process, to herd people together? We've got a big community. And as Commissioner Hardin said, there are a lot of people that want to help, but sometimes help is not really help if it's not coordinated, if it's not you know? So what can we do to help get the resources that we need to get so that they can be coordinated?
One thing that would be helpful is, as you hear from individuals in the community that want to help or that are doing things, just asking the question, are you connected with the concerted efforts, the collaborative efforts at the county level through the EOC? And if not, refer people to us for that. I found the email address, and I'll make sure that that goes out to each of you, but I'll also mention it right now. It's charmecEOC@charlottenc.gov.
Now, one thing I've heard is people feel like I'm communicating, I'm calling, nobody's calling me back, I just can't connect with anybody. What do we do about that?
That's the other thing you can do, is let me know if that's happening. Because if I don't hear that it's, you know, that there are issues, I can't address them.
They have a volunteer number.
Well, they haven't, I've talked to them possibly
Not my
about a
7
number. We don't
minutes.
have a number. Oh,
Go ahead.
I'm sorry.
Yes.
Okay, we're dealing with time, and
Okay.
Commissioner Fuller's saying that that's not his question, so we're going to give him 2 seconds.
Okay.
Just 2?
What did I just tell you all ago?
All right, so, and then, so 2 last questions. One is, maybe this is not a question for you, maybe it's for the county manager or the county attorney, but what is our role as a board
That's what I am.
in, but I mean sort of legally, what's our role
You don't have.
in responding to this crisis? Okay, hold that one. I'll do the last one.
Thank you. I want the county attorney to address that. That's okay.
And so I'll do the last one, which is, can you give us some insight? I mean, people keep talking about the virus in these general terms, but can you give us an insight into what we should expect? If you've got these symptoms, you've been tested, what happens? What's the course of the disease? How do we know when things have gotten better? Give us a sense of that.
So if you test positive, one of the first things that'll happen is you'll hear from the health department. We're isolating individuals who test positive, and that is an actual order that is signed by me that gives them specific instructions about what they can and can't do over time. And then the next thing we do is we talk with you, we investigate, we figure out who you potentially have exposed, and we go from there. What you can expect in most cases is a fairly mild illness. It could be like anywhere from a nasty case of the flu to some folks who are feeling like they just got a bad cold. The guidance for when we can release people from isolation is changing. At one point, we had to have 2 negative tests within 24 hours. Well, we didn't have enough tests to do that. So that guidance is changing, and as it has to do with your symptoms. And so we'll be in touch with you about that as you move forward, and then we'll let you know when you can be back out in the community.
So essentially, the health department is following you through.
Yes, we are having conversations with you every day. You're taking your temperature and reporting that to us every day. So we are on the phone with you every day, finding out how you're feeling, what's going on. Now, for those who are more ill,
I got one
obviously,
last
they might be
question.
in the hospital.
I got one last question, because I'm telling me, my Grim Reaper is telling me I'll have a couple. See? Look what he did.
No, I'm going to let you ask your question.
So my last
because you were interfered
question,
with.
my last question had to do with what our role is from a legal perspective with respect to the response to the virus. What's our role as a board?
Well, in Mecklenburg County, you know, we're a Consolidated Human Services Agency. So the role and the function in what was formerly the Board of Health has been consolidated in Mecklenburg County, vested with the manager, and is now vested with the Public Health Director, and Gibby Harris. So you give guidance through the manager. She makes the decision, give directions pursuant to 130A as to what the health department can and cannot do pursuant to the statute. But the board itself hears from the health director and can give guidance to the manager as to how things should be done in the community, consistent with what 130A lays out. And there's a whole litany of things that she can do that can be done, particularly in a state of emergency. The board doesn't get into the day-to-day operation, but gives more policy setting and guidance in that regard.
All right, very good, thank you.
I'm not
All
sure I
right.
heard him clearly. Mr.
Commissioner Jarrell.
Thank you, Mr. Chairman.
Did she say? He say?
Jimmy, thanks for the report. I've got quite a bit. The first thing I think, I don't want to be repetitive, but I don't believe anybody's touched on information as it relates to the jail. Can you help us understand exactly what we're doing with that population? Are we testing? Are we releasing low-level offenders? What does that look like for the community?
I'm gonna answer that.
Do you have specific
Yeah, so we have
information?
been in conversations with Sheriff McFadden. They're working with their healthcare provider in the jail, WellPath, to screen people as they're being brought in to the jail, testing them, not testing them for COVID, but taking temperatures and other things, making sure they don't present. If they do present, then they don't really have the ability to quarantine, but they are making sure that they track those prisoners. One of the conversations that we have had is issues around federal prisoners that come in from other places, and he has been in because obviously we don't know exactly where they've been or where they're coming from, and he's been having ongoing conversations with the marshals about how they're going to handle federal prisoners. So we have made it very clear to the sheriff that we are here to support him. But he's got some procedures in place, and he knows that we're here to help him in any way that we can.
So
We're not doing early release, though. I know that he mentioned that other communities are letting people out early and all that. We are not doing that here, as far as I know.
Okay, so to follow up on one point, we don't have the ability to quarantine. So, Gibby, what I want to know from you is what kind of risk will that pose to the community?
Likely not a huge risk to the community. It might pose a big risk to the entire population in the jail. So we are.
Officers, the detention officers or they're not at risk and when they come back into the community?
Well, they could be if they're exposed. Again, WellPath is trying to stay on top of that and working within the jail with individuals who are ill, who have symptoms. And if we have someone we need to isolate or quarantine, we'll work with Sheriff McFadden to make sure that situation is made available. I'm not sure that it's available within the jail setting. We may be taking someone out of the jail and isolating or quarantining them somewhere else.
But we have not heard from him at this point in time that they have any folks in the detention center that meet that criteria.
Sure.
So he will certainly let us know if that's the case.
No, I get it. Maybe it's not really answering my question. I guess what I'm saying is we have detention officers there that are engaged with that population. But I'll wait for us to hear back. But I would like to know what level of risk that is. But moving on, because we only have 7 minutes, so I want to make sure I got a lot to cover. The other thing that's really, really important on my radar is communication. As it relates to communication, I see, and Commissioner Harden touched on this and other commissioners, that there are groups out here in the community that are way ahead of where we are. Everyone doesn't have access during the day to listen to the press conferences. Everybody's not calling the number and everybody's not going to the website. I would really like to get a handle on the way we disseminate information and a repository. Madam Manager, you've been great at responding to the questions that have been, fielded. I'm suggesting that we take a look at creating some sort of repository that captures all of the questions that are coming out, all of the answers that are coming out, so we have one central location as electeds or community leaders that we can go to, that we can share with our colleagues in the city, our colleagues at CMS or any other entity. So I don't know if that's something that we can consider, Mr. Chairman, but I think it would be useful at this time to collect all those questions that are coming from the community.
So we update our website every day, and so we can add a section on our website that includes these questions.
Yeah, I think that would definitely be helpful. So the next one would be, I'm trying to figure out, Gibby, if you can give us a sense when we look at what we're seeing in San Francisco, what we're seeing in New York City and some other places, how close do you think we are to potentially a shelter in place? And again, this question is not to cause panic. It's just so that we can properly prepare.
I think we may be moving in that direction more quickly than we'd like. What we're trying to do in the county is prevent us from getting to the place where a San Francisco or a New York has found themselves. The restrictions that we're putting in place way quicker with the number of cases than have happened in other places. We're hoping that that's going to have the impact that we want it to have. This is just a new situation, and so it's hard to know that for sure. But we will continue to look at what it takes to try to isolate this infection in our community and keep people from being infected. Unfortunately, with the new cases that we have, what we're recognizing is that we now have community spread. And this goes back to your question about the jail. Those detention officers could probably just as easily become infected in the community as in the jail. And so with that situation, we are probably looking at moving more rapidly to more restrictions as time goes on if our numbers go up.
Thank you. One last question. This is to the manager. Is it possible for us to look at, when we talk about community organizations and the faith community that are trying to volunteer, I know we have the email address. Can we look at potentially having a staff point of contact that proactively goes out and tries to connect to these folks out, as opposed to flipping it the other way, to be that sole point of contact whose sole responsibility is to connect with those organizations in the community?
So what I would suggest is that we will bring this back to the EOC. The EOC is our response incident command for this incident. All of those issues are being addressed by the EOC, and if that's something that, that group, they have a planning team, and this is one of the things that they're working on is community response. And we will let them make decisions about the best way to execute on that. We have been very, very conscious and very, very intentional about going through the EOC to manage this incident. The minute we go outside of the EOC and everybody starts making independent decisions about how to engage, we don't have a unified response. And so we will bring this back to the EOC and have them take a look at that.
All right. Commissioner Scarborough, you have any questions?
No, I'm good.
All right, Commissioner Cotham.
All right, thank you, Mr. Chairman. Gibby, you said in your comments that you're expecting a significant amount of more test kits. Can you define what significant means? Like, what are you talking about?
Well, I think what we're looking at right now, because both Atrium Health through their testing in-house and Novant through their testing with LabCorp have gone to a new testing platform that's going to allow for a quicker turnaround on test results and also make them more available. So, I think we're at a point where we may be getting, within the next week, the capacity of doing, if we have the capability of doing several thousand tests a day. But we just need to know that those entities, so there's several levels in here. There's the taking of, just depending on how much is flowing through those systems. So, but we're thinking that we are ramping up fairly quickly and thinking that we're going to have a much higher capacity within the next week.
Okay. Could you tell me about the hotline that we've had, the usage rates? How many calls are we getting? What are the calls about?
It varies, and it depends on what line they're coming in, because we have 5 different lines on that call. One is specifically for individuals who think they may be infected or are having symptoms or may have been exposed. One is for medical providers. One is for the community at large who has questions. Another one is for the media, and then a 5th is for those organizations and community members that we work with who have specific questions, whether they're concerned about a staff member or whether something's happened in their facility. We're from 50 to several hundred calls a day.
Oh, okay, all right, thank you. And you said earlier that 80% of the cases when the people get it, the virus, are mild. Is that, when you use a number like that, are you just talking about Mecklenburg, or are you talking about a national number? Could you?
That's an international number.
Okay.
Yeah.
Okay, so going forward, if you're just talking about a Mecklenburg, you're always using the international numbers?
For that particular percentage, we've been using an international number. When I look at the what I said in terms of survival rate, the 98%, that was based on United States numbers.
Okay.
If I used Mecklenburg County based on the cases we've had so far, I'd say that probably 80% of them have been mild, and the other 20% have been moderate.
Okay.
And if I look at, obviously, we have not had any deaths in Mecklenburg County at this point, so 100% survival rate so far.
Okay. The last thing I want to ask about is our own employees. I know, especially the social workers, the caseworkers in DSS often go into homes, and I'm sure they have directives to, be properly, to have hand sanitizer and maybe a mask, I don't know. But I know supplies are limited.
Mm-hmm.
So what are we providing that, or are we trying to get, what's happening with our own, just to keep them safe?
Yes, they have been given some specific guidance from the state on what kind of equipment they need, and we're working through our procurement department as well as the EOC to get those supplies for them. So we are in the process of getting those supplies, so they'll have them when they go out. We've worked with them on developing a questionnaire for home visiting that's working very well, and the expectation is that they're calling ahead to find out if anyone in the home has been sick and getting those questions answered, because sometimes they may need to reschedule rather than go into the home.
So right now, and I'm sure, I'm not surprised, but right now, some of them probably don't have the supplies.
Some of them
Just like
do
I
not.
don't have any hand sanitizer, I can't find any, so
Exactly,
So
yes.
it's just, but you are making efforts to
Absolutely.
fill that gap. Okay, all right, I think that's fine. I'm a little over 5 minutes. Thank you, Mr. Chairman.
All right, thank you. You saved us 2 minutes. All right, Commissioner Powell.
Thank you for all your hard work. We hear urgency in some of our emails, and I always forward that to make sure that you guys know, so that everyone's informed and on the same page. And thankful that the and aquatics centers are closed down. There is some urgency. I know you know this about childcare restrictions. People want to know, and it's my understanding that it'll probably be addressed tomorrow.
We're expecting something from the state in the next couple of days.
Okay.
One of the groups that the governor put together was one specifically focused on the child care issue, and I think that Secretary Cohen is leading that discussion. So we're expecting something from that fairly quickly.
Thank you. And I just want to say that I think it's really important on whatever hotlines we have, that we have human beings answering the telephone.
Yes. Some of those lines are 24/7, not all of them. There are other options for individuals. The other thing, and this goes back to the coordination piece, both Atrium and Novant have hotlines as well, so we're working to get better organized around our hotlines to make sure that people know where to go to get the best information when they need to access us and when they need to access the others. So hopefully so we're leveraging our resources in a better way. And they have the ability to be more 24/7 than we do at this point.
And I know we need our public information experts to consolidate all this, but we really need clear, consistent communication on, easy to find, like, where do I call? Because I think right now, even if you see on the TV screen, they list 15 numbers, and you're like, well, I need more guidance than that.
On which one?
Yeah, so if we can.
There's a federal hotline and state hotline, and several hotlines in the county, and, yeah, so we'll get better organized about that.
Yes.
It's one of the things we're working on right now.
And then another thing, I just want to talk about the positive things that are happening. So if anyone in the community has an idea about how we can do better, something that they think, oh, you know, I have this idea and want to share it, a good way to share that is through email so that we can get it to everybody. And it happened today. Rivendell Farms reached out to offer to help our GIS team, and they want to share their food system resource information mapping that they've been doing for 18 months. And so I want to hold that out as an example of somebody coming in to say, we can help you. And then our Nancy Ross in GIS said, thank you so much, let's work together. These are the kinds of things that we need from the community. So if you have an idea, reach out to your county commissioner, reach out to one of us, and we will marry up the right people so that we can work together on problem solving. It's a lot better to problem solve than to criticize. And so I just want to say that out loud because I really thought it was so nice of them from Rivendell Farms to reach out. And the other thing I think that is positive is that based on what we've learned from other places, we've been using that information based on what we've learned about the exponential growth to guide us. And I don't know if people realize how much that has benefited Mecklenburg County. So I think that by quick action, that we have prevented a lot of suffering. And thank you for that. Thank you, everyone, for that. And the last thing that I want to talk about, because I think it's really important, is people are scared. And we need to recognize that people are scared. And I have two stories, and some of you guys may have heard it, but one little boy was sniffling in the middle of the night and had a cold last night and started crying and sobbing. And his father said, "What's wrong?" And he said, "I think I have the virus." And so a lot of adults are running around not thinking about what impact it has on our children. You know how scared they are? And what impact this has on our seniors. You know, a lot of them are scared. I have a family member who's in lockdown in Georgia in an assisted care facility. And so he's scared because he can't have any interaction except with staff. And so that's why I said, do something positive, like, you know, call somebody that might be scared. It's, we have to be positive. And I think panic and negativity is affecting people. And so I'd like for you to speak to that mental health. You know, we're doing as much as we can do. And while we have to do it and it's scary and we're doing all we can to prevent contamination, but it's very survivable if you do all the right things. So please speak to that.
I couldn't agree with you more. I was asked by the media at one of the events what my biggest concern was, and I said panic. I think that whatever we can do to help people feel safe and feel that there are good things happening that are going to help keep them safe, but also that they have some control over this situation. And that's why I keep putting the 80% out there. There is some control over this situation. Yes, it's serious, and we need to pay attention to it. We need to do what we can to try to keep it from becoming what it has been in other parts of the country and other parts of the world. But I do believe that we do have some control, and that we're doing everything we can to help the community be as safe as it can. But it's all of us together. And I think that's the positive part, is people are pulling together in all kinds of different ways to support each other, and we need to continue to lift that up and continue to look for ways to tell those stories.
And so since my alarm didn't go off yet, I just want to say that the other day in I think it was Charlotte Observer, I'm not sure. Oh, I think it was Charlotte Observer. I saw a picture of the team. So I saw Derek and Dina and you and Mark and Leslie and Anthony. And when I looked at the picture, I felt love. And I think that matters. Like, I think if people knew how much love you had, all of you in your hearts, in the work that you did to protect everyone in Mecklenburg County, they would feel so happy to know that such good people are in charge. Thank you. Thank you for your leadership. Thank you for caring so much. I appreciate you.
Thank you.
All right, Commissioner Susan Rodriguez McDowell.
Thank you, Mr. Chairman. First of all, I would like to say thank you to Gibby, to Dina, and the entire team. I know this is hard, stressful work that you all have been doing, and I just have felt just a steadiness from the team. I really also want to say that I appreciate the frequent communication that you all have been doing. I think that instills confidence in the community when we are bringing the information forward. So thank you for that. And I also want to say thank you for acknowledging the fact that we have community spread. I've been hearing a lot of frustration from people who are saying, you know, why do we keep saying there's no community spread when we really just didn't know because we didn't have tests. And so until we had the testing to confirm it, we couldn't acknowledge it. And so I'm thankful that we're finally acknowledging it. I think it's a huge step. I think we really need to brace ourselves because of the spread. The length of time that it takes to actually get a test, in our case, it took 48 hours in the middle of symptoms, with symptoms to be able to get a test, 48 hours. And then to get results, it's going to be at least 72 more hours. So this is quite a long time that I really hope that we're able to cut down these times, because I think that's where we'll just get more and more community spread when people don't know. I think people don't realize that they could be carrying the virus even if they don't have symptoms. So I think that's super important for us to make sure that we're getting that message out over and over again. It's been a little bit hard to follow the meeting through the phone, and so please forgive me if I'm repeating anything that you guys have already said. I do know that we've talked a bit about the Emergency Operations Center, but I wasn't able to get the contact info, and I think there might be others who are listening who didn't get the contact info. So if you could please share again that, I don't know if it was a phone number or if it was a SHARMEC ... I don't know the rest of if it was a website. Can you share that information again?
Yes, it's SHARMEC EOC at Charlotte, what did I say? NC.gov. Hold on a minute.
We can email it out.
We'll email it out to you.
Okay.
We'll email it out to everyone, and we'll make sure that it gets put up on the website so people can access it.
Okay, that'd be great. I really appreciate that. And so the question that I do have for you is our capacity if we do get this huge spike in confirmed cases. And I know that there will be confirmed cases of folks who don't need to necessarily be hospitalized, but if we do have a spike in the kind of cases of folks who do need to be hospitalized, can you please speak a little bit to our capacity as a community to be able to have enough beds?
That's a great question. A lot depends on how much of a spike we would have. Our hospital systems have been working for the last couple of months to look at ways to increase their capacity, to reorganize their systems, to be able to meet the needs as they come in. And we are also prepared, working through emergency management, both locally at the state and the federal level, to bring in additional resources if we need to. Obviously, we're not at that point now. I know they're having that conversation in New York right now because of the number of cases they're having. But we are in conversations and planning around that so that when it happens, we're ready to pull the trigger to get the resources here that we need. So whether we're ever going to be able to fully meet all the need, that's a good question that I don't think anybody has the answer to right now.
Okay. Are you speaking about like setting up tents, like for capacity, like they were talking about in New York, or are we talking about, I think I heard mention of a motel at one point. Can you speak to where we are with that?
Well, in terms of the hospitals, they do have the ability, with support from the state and the federal government, to set up tents if they need extra tents, to get more ventilators in if they need them. Again, we're competing with every other community that has that need as well, so just be aware of that. Within the county, we are looking at what other types of facilities or spaces that we could make available if we needed to isolate or quarantine people who may not be able to do it in their homes. So we are exploring all of those options right now, and are very far along in the planning on all of those issues. So again, we are lucky in that we have not come across that situation yet, and we still have time to continue to plan and implement. But I feel good that we are having the conversations and know how we're going to react if it happens.
Okay. Thank you so much. I really appreciate you guys letting me ask a few questions. Thank you, Mr. Chairman.
Thank you. All right. First of all, I want everybody to know I'm under the same 7 minutes. So I have 3 questions, and they're really, I think, for the benefit of this board. Given what we have discussed over the period of the year and several months that we've served together, there are a number of issues that have come up, and some of us didn't really understand that. So this is the perfect teaching opportunity to deal with that. Number 1, Emergency Management Director. You are given a specific role as you responded to a question that was asked. You said, that's the role that I've been given. So would you please explain to the board and to the community what happens once a declaration is signed by the chair and the mayor?
Okay, so there are a number of different, well, there's several different declarations that can be signed. Obviously, the governor has signed a state of emergency, as has the federal government, and now both the mayor and the chair of our board has signed a declaration of emergency for Mecklenburg County. What that does for us, number 1, it just solidifies the organization of emergency management and the EOC as our coordinating effort in this community around the work that we do, but it also allows for a freer flow of resources from the state and the federal government, as well as gives us a little more say as to how resources are used in this community to combat the situation. So it just increases our ability to be more organized and to have better access to resources.
Thank you. Along those same lines, we've had discussions previously about the difference between a consolidated board versus a board of health.
Yes.
Had we had a board of health, talk about the difference in how you would have had to operate.
I'm going to let legal talk about that.
It's a complicated question.
It's a complicated question,
But under Consolidated Human Services model, you vest the authority with the spokesperson. Here would be Ms. Harris. If you're looking at a Board of Health, you've got to get the board to act and react. So it really hampers the process, which is what the thought was behind the board when we consolidated to pull these services together, that you have a focal point who can make the decisions. When a declaration is entered by the governor or by the Board of Commissioners, it empowers the health director to do things broader than just quarantine or isolate. It allows her to do things that are more broad, whereas you had the Board of Health, you have to go back and get approval. So here it gives more guidance and I think more flexibility for the health director to act more expediently than if it had to go through a board.
I just thought this was the perfect opportunity to explain that, because we had that discussion and there were people teetering on both sides of why we had what we had. And I just thought what happened during this incident was a perfect example of why it was so important for us to have the Consolidated Board. And then the last thing, this board has oftentimes talked about how much we have in reserves and how we should spend our reserves down. To me, this was another perfect example of why the county has the reserve funds that it does have, because we can't spend them in both places. We can't spend them down and then expect them to be available in emergency situations like this. I had this conversation with Commissioner Harden earlier today, and she said, I yield, I give, you're right. So Dina, would you talk about the ability to make the recommendations and decisions that you've made, given what previous boards have done to reserve funds and make them available for times like this and futuristically a recession, which is probably more likely than not?
Correct. So our fund balance policy is very specific in that the money needs to be used for one-time non-recurring expenses, but there's also an emergency provision in our fund balance policy that allows us to use fund balance for operating expenses when we have a financial crisis, to allow us to be able to maintain service levels. There's also a provision in there that says that we have a payback responsibility. So if our fund balance gets below the threshold that we've stated, which is 28% of revenue, then we would have 2 years to repay that to get us back up to our reserve level. The good news is that we're not at risk today of falling below that threshold. So we do have the opportunity, if there is a recession, to use our fund balance to maintain service levels and not have to do what we did in the last recession, where we had to lay off 10% of our workforce in order to make our budget balance. So I think we're in much better position now because we have those high level of reserves than we were back in 2010.
And then lastly, I just want to say to my colleagues, I really appreciate the questions that were asked. There were things that I wondered myself, and from the questions you raised today, I was even more enlightened, because I tell you, this is a whole lot to get your head around. And so thank you for the questions that were raised. Thank you, Gibby, for your willingness to answer and respond to those concerns, and to the rest of the staff as well.
Thank you, Gibby.
Thanks.
I think she's going to go off now and talk to the media and see if they have any additional questions. So with that, I'm going to go on to the third item under my manager's report, which are the three other additional items that I asked you to act on. I put those in my series of emails, and I'm going to kind of walk through that now. The leadership has worked diligently to implement alternative staffing models to support county needs and reduce exposure to the COVID-19 virus. We've revised our telework policies to expand the number of employees that can work from home. Our goal is to have as many employees as possible that can work from home do so, and that will actually start tomorrow. We're also proposing an emergency leave policy that would provide employees the ability to take time from work and not use their current leave time. And finally, we are eliminating certain face-to-face public transactions if there are safer alternative methods. In order to proceed, I'm requesting that the BOCC approve the following three items. One is an adopted emergency paid leave policy for up to 80 hours of emergency paid leave related to the coronavirus effective March 16th, 2020. All Mecklenburg County employees would be eligible, including full-time, part-time, and temporary employees. Full-time employees will receive 80 hours, and part-time employees will receive the equivalent of their 2-week work group scheduled hours. Eligible use: an employee or an immediate family member is quarantined or isolated for COVID-19 and is sick or exhibiting symptoms. If Mecklenburg County suspends any business function and cannot provide an alternative work option to the employee of the suspended business function, including telework, alternative work site, or redeployment to another business function, or if an employee is unable to work due to COVID-19 school or child care emergency closing, impact his or her dependent children, and the employee does not qualify to telework. In terms of carryover, any unused emergency paid leave hours will carry over, but is restricted from pension earnings, termination pay settlement, and vacation cash out. Further reauthorization, based on an assessment of the situation, the county manager may reauthorize emergency paid leave as circumstances require. Number 2, affirm the accelerated purchase of 600 laptops, peripherals, and docking stations in the amount of $1,072,148.36 to allow telework for county employees and call centers. In addition, appropriate $173,300 for equipment deployment support. Funding for this is from the general fund. Justification. Most of this request is an acceleration of computer equipment slated for evergreen replacement in the upcoming FY21 budget. In addition, mobile laptops and headsets for call centers will provide needed telework flexibility for the COVID-19 response and future emergencies. The third thing we're asking you to approve is order the tax collector to suspend in-person tax payments during the COVID-19 state of emergency. North Carolina law requires that tax collectors accept national currency for payments per North Carolina General Statute 105-357A. However, in consultation with the North Carolina School of Government, the county BOCC can eliminate in-person tax payments so long as taxpayers have other reasonable options for timely payment. Taxpayers may use alternate methods as permitted by North Carolina General Statute 105-357B, including paying online, by telephone, or mail. These methods currently exist for Mecklenburg County taxpayers. This order to suspend in-person tax payments during the COVID-19 state of emergency will have minimal impact on taxpayers, as Dropbox collection boxes will still be available at Valerie Woodard for taxpayers wishing to pay with currency. And I can certainly answer any questions that the board may have, but those are the 3 actions we're asking you to approve tonight.
Mr. Chairman, I move for adopting the resolution, for approving the purchase, and for authorizing the temporary suspension of in-person payments.
Second, Mr. Chairman.
All right, thank you. Thank you, I really appreciate that. All right, all 3 action items are being moved for approval. It's been moved and properly seconded. Any further discussion?
I do have a question.
Yes, sir.
Mr. Chairman. Manager DiOrio, I thought I heard you say 600 laptops, not the 850?
Oh, I apologize, it's 850.
It is the 850.
850, I apologize, yes.
Okay, and then, and I thought you had mentioned a lower number, $1,072,000. This says 1.57.
Yeah, my talking points are not up to date, I apologize. It's $1,547,148.36.
Okay, all right. So I'll
As
amend my
amended.
motion.
All right.
Thank you.
All right, any further discussion? Hearing none, all those in favor of the motion, let it be known by saying aye. Aye. Any opposers?
Aye.
Any opposers? That's Commissioner. She's voting for it. Any opposers? The ayes have it, so carries the motion.
So one other thing, I want you to know that we have prepared a news release. It's very extensive about all county services and how.
We need that.
Yes, I'm going to get it to you. How residents can access services for the foreseeable future. So we will make sure that you get this in your email, and you should push this out through all of your social media channels and your network so that the community knows exactly how to access services during this time. We are doing this for a 2-week period, but I do believe, based on conversations that I've had with Gibby, that will ultimately be extended. I think 2 weeks
Why is it so long?
What?
So much information.
What's so long?
No, I'm seeing the
Because basically what we are doing is we are
3
changing
pages.
the way services are going to be delivered over this period of time. And so people that normally come in to access services in person are going to have to access them differently. And this is the document that explains how those services will be accessed. It will also indicate which services will not be able to be provided because they require face-to-face. And we are not going to be putting our employees at risk of providing face-to-face services unless they are mandated to do so, like Commissioner Coppa mentioned, around child protective services and other things where they're required to do mandatory home visits.
Okay.
But we will make sure you get this document ASAP tonight.
Hard copies?
Excuse me?
Hard copies.
Of course. How many would you like?
I'll talk with you later.
Okay, but I'll get somebody to start making those copies while we're in the
Thank
meeting.
you.
Yes, Commissioner Powell?
So that we have clear, consistent communication, that will be on the Mecklenburg County website, correct?
Yes, it will.
Okay, because I think that's the most important thing, instead of, getting a message from multiple people. I think if we just steer everyone
That's right.
to the Mecklenburg County website, I think that's the smartest thing.
And we also are doing a joint release that the Emergency Operations Center is going to do a joint release with our information as well as the cities.
City.
So that there'll be one communication from the Joint Information Center about the impact to city and county services, and that is being prepared.
Is that also being done for the 6 towns?
The 6 towns are also, they are also plugged into the Joint Information Center, and they are supposed to be putting their information into the JIC as well. So that, again, that's why we have this infrastructure, so that all that information can be consolidated and communicated out simultaneously in a consistent way.
All right.
Commissioner Cotham.
Is it possible to get that in Spanish also?
We can do that. I can tell you that we've had some challenges getting some of our posters and flyers translated. It's taking a little bit of time, but I think that's a great suggestion, and we will send it to our translation folks to see if we can get it done quickly.
Mr. Chairman, could I ask one more? One last thing that I wanted to ask. I've had a lot of calls from homeless people who are, with all the restaurants closing and the libraries closing, that they don't have a place to go to the restroom. Is there any way we could get some porta potties like they have during the parades, maybe and station them uptown?
So that's a great suggestion, and we will put that again to the homeless group that's working in the operations center to address that issue. That's a great question.
If they could get the ones that have the attached sink where they can wash their hands, because I've seen that in other cities. It's just a small thing that attaches to it. I just ask you to think about that. Thank you.
I will tell you that we are not closing the restrooms in our parks. We've had that conversation, and I've said that would be unacceptable. So to the extent that we have restrooms at Romere Beard and at First Ward, those will be available, but I think that's a great suggestion, and we'll certainly take that back.
Okay, thank you.
Thank you. Is that the end of your report?
That concludes my manager's report. Thank you very much for your support.
All right, thank you. Before we move on to our awards and recognition, there is some unfinished business from our earlier session. The chair will entertain a motion to authorize the county manager to negotiate and execute all documents necessary for the acquisition of tax parcel 169-151-01 through 169-151-117, also 169-151